All right. I was looking at some of the notes for today's episode, and it really caught my attention that kidney disease is often referred to as a silent condition. Like, what does that, actually mean for us regular folk, Sophia? It sounds quite concerning, actually.
Mohammed, it's truly one of the most insidious aspects of kidney disease. Most people with it simply don't realize they have it. The symptoms, they just don't appear until like the very advanced stages. So you simply can't rely on symptoms alone to tell you something's wrong. This is why getting those regular checkups, like, absolutely crucial. We need to actively look, for the signs. It's not something you're just gonna feel suddenly.
So, if we can't feel it, what exactly are we looking for then? You mentioned regular checkups. What tests should we be asking our doctors about specifically? And, like, what do those numbers even mean?
Right. So there are two main tests you absolutely need to know about. First, there's a blood test called GFR. That's your glomerular filtration rate. It's basically your kidney filtration rate, like a percentage of how well your kidneys are working. Normal GFR is usually between 70 and 100, though it can decline a bit with age. This number tells you how efficiently your kidneys are filtering waste from your blood. Then there's the urine test, called ACR, or urine albumin creatinine ratio. This measures protein in your urine. Healthy kidneys, they keep protein in your body. So leaking protein, that's a big sign of damage, and higher risk for progression and cardiovascular events too.
Wow, so it's really about being proactive, right? But let's say someone hasn't had those tests and things are, already further along. Are there like any symptoms that might finally appear, even if they're quite late in the game?
Yes, absolutely. But you've really got to understand, these are typically like very late stage indicators. You might experience profound fatigue, just a persistent tiredness that doesn't go away. Swelling, particularly in your ankles from fluid retention, is another one. Then there's shortness of breath, which can happen if fluid builds up in your lungs. Some people also report nausea, vomiting, or a lack of appetite. And itchy skin is a fairly common sign too, as toxins build up. For men, changes in urination, like getting up more at night, could also be related, especially if it's connected to prostate issues. But again, like, waiting for these means the disease is already quite advanced.
That's, honestly, it's a bit scary how subtle it can be. So, what can we actually do to, like, prevent kidney disease in the first place? What are the big things we should really be focusing on?
This is where, like, empowerment comes in, Mohammed. The biggest culprits for kidney disease are diabetes and high blood pressure, right? So prevention is all about managing these risks proactively. Lifestyle choices are your first defense. You absolutely need to control your salt intake. Dr. Pandya, the nephrologist, he confirms salt definitely matters. Eating a heart-healthy diet rich in whole foods, fruits, vegetables, lean proteins. Also, avoiding smoking and limiting alcohol is critical. Regular exercise and maintaining a healthy weight are also, like, huge. And a big one, really important, avoid chronic NSAID use. Ibuprofen and naproxen can damage kidneys. Tylenol when tossable.
So, a lot of what you're saying, Sophia, sounds like general good health advice, right? Like it resonates with avoiding heart disease too. Is there a big connection between heart and kidney health? And can kidney disease actually be like reversed or halted once it starts?
That's a fantastic observation, Mohammed, and you're totally right. The heart and kidneys, they're incredibly linked. Your kidneys are extremely vascular organs. They actually receive like 20% of your heart's blood supply. So if your kidneys are sick, your cardiovascular system is at high risk. And if your heart is sick, your kidneys are, also at risk. Protecting one absolutely protects the other. That's why the lifestyle changes are practically identical. Now, about reversal, sometimes, yes, if the cause is identified and addressed early, like stopping NSAIDs or relieving an obstruction. More commonly, we can dramatically slow or halt progression, especially with the really effective new therapies developed in the last 5 to 7 years.
That's, actually quite hopeful. Now, what about genetics? If my parents had kidney disease, does that mean I'm, like, destined to get it too? Is there a strong genetic component?
It's a really, really common question. The most common genetic kidney disease, that's polycystic kidney disease, or PKD, and yes, that can be screened for. But for most other types, a family history just gives you a predisposition. It's not a guarantee. Your lifestyle and how well you manage conditions like diabetes and hypertension play a massive, massive role. It's truly about proactive management. So your action plan is clear. See your doctor annually, know your numbers, ask for your GFR and urine ACR, adopt that kidney healthy lifestyle. Eat well, exercise, avoid chronic NSAIDs, and don't smoke. And finally, aggressively manage any underlying conditions you have.
All right, before we wrap up today's vital discussion, I want to take a moment for something important. This podcast is sponsored by J360club.com. We're a community for those committed to a better world. If you want to enhance your social and economic well-being and share our values, join us today. All it takes is a quick one-time registration. If this resonated with you, if for the first time the path to real wealth feels clear and not confusing, then do 3 things for me right now. 1, subscribe to this podcast. We go deeper on these frameworks every single week, and you do not want to miss it. 2, take a screenshot of this episode right now, post it on your Instagram or LinkedIn stories, and tag me, comment. Tell me what feeling you want to sell. I'll be replying to as many as I can, giving feedback and advice. 3, share this episode with one person. Share it with the friend you're always brainstorming with, the colleague who you know is meant for more. Because the best way to solidify your own knowledge is to share it.
Thank you, Mohammed. And that message of community and proactive well-being truly aligns with what we've discussed today regarding kidney health. It's truly a lifelong journey, not just a one-time checkup. The sustained effort in managing lifestyle and underlying conditions is paramount for long-term vitality.
Indeed, Sophia. It seems the biggest takeaway is not just awareness, but consistent action. For listeners who might feel overwhelmed after learning all this, what's like the single most empowering message you'd want them to leave with today?
My biggest message is this. You have more control than you think. Understanding your body, asking the right questions, and adopting a preventive mindset, these are your most powerful tools. Small, consistent steps accumulate into significant long-term health benefits. Don't wait for symptoms. Be proactive now.
Powerful advice as always, Sophia. It's clear that taking charge of our kidney health is a crucial part of our overall well-being. Thank you for shedding light on such a vital yet often overlooked aspect of our health.
My pleasure, Mohammed. Knowledge is truly the first step